Hi, we're here to demonstrate putting in an indwelling catheter. To put in an indwelling catheter, you need your package, which is, you want to check your package to make sure that it's completely intact. There's no problems with the package itself. You want to place it on a clean, dry surface, which includes decontaminating with a sandy cloth or some kind of germicidal disposable wipe. You always want to check your container to see how long the disinfection time is. For this particular product, it's 2 minutes. So you want to wipe off our surface with the cloth and let it dry for a minimum of 2 minutes. When you're opening up the package, if you want to follow the glue line of it, it makes it easiest sometimes. Sometimes not. There, see, okay. So, just follow the glue line around the bottom. Open up the package, and we will dispose of this. We do not need the top package of the container. We do want to keep the orange stickers because you want to place the middle sticker on the bag after we've inserted the catheter. And we also want to put the little orange sticker on the chart. So we're going to set that aside. So on your clean, dry surface, there's also instructions on the bottom of this in case you forget how to put your catheter in. Otherwise, so we have our surface at waist level. You always want to open a package away from you. There's a lot of memory in these packages, so you want to pull back and kind of give it a little bit of a tug. Then you want to pull from the other side, and always kind of staying in the middle so you're not close to the part that is sterile. And then you have your handy assistant with you. And the first thing you're going to find in your package is the under buttock strap that will go shiny side down. Let's go ahead and do that piece. The other components of the package are some towelettes to do peri-care and actually hand sanitizer, but you'll want the peri-care. So the assistant will perform peri-care by using the 3 wipes in there. And we'll let her do that, and we'll continue on with setting up our sterile field. So you want to pull from the inside of your package, again, so you're not touching the edges or the corner. I like to turn it around. Now you have your sterile field, and your sterile field is, remember, 1 inch from the edges. You don't want to cross over your sterile field. Crossing over your sterile field can allow for skin or whatnot to flake off into your field. But in order to get the gloves out, we do have to go into the field. So you want to go in, and again stay and come out quickly and not touch any of the inner parts of the container. You want a nice surface for your gloves so that you're not, again, crossing over your sterile field. You want to open your gloves, again, a lot of memory in this. Remember, if it does flip back, then you've got a contaminated glove and you need to get another pair. You want to pick it up on the inside of the cuff, step back, 4 fingers under the cuff, lift up, not drag, and again, step back. Keep your thumb out so you don't risk contaminating that in your car. Then you'll walk back to your sterile field, and you'll want to keep things as close to you as possible. Remember, we've got that 1 inch. We're going to put that there. We're going to move this around, so we're not going to use that. And then we're going to lift the tray out. First thing you'll want to do for the tray is to open up your swabs. And discard. and put our 3 swab sticks in. Next, you'll want to remove the blue lining. And you want to keep your catheter in and step back and throw your blue wrapper away. The other items in here are the water for the balloon. We want to hook that up. We want to get as much ready as we can before we get ready to go down and cath. This is the lubricant. If you simply take the end off and pull the plunger out, it gives you a nice reservoir to put your catheter in to get it lubricated. And then everything's packed in your nice little package. So then, reaching the inside of this again, you always want to keep your sterile hands safe. You always want to be able to see your fingers at all times. So keeping your fingers high on the container, you want to come in. And then you're going to spread the labia so that you can see the urethra, the clitoris. You'll need to be able to identify the urethra. You'll want to take your swabs and you'll go down the one side, down the other side, and then one down the middle to make sure that you can see and that you're going over the urethra. If it's a blind insertion, you can't really see it, you'll kind of want to start at the clitoris or whatever you can identify there and follow that down, but make sure you go good with that. Then this we're going to cut across. We've got good visual, we've got good light. We hold the catheter a couple of inches from the end. We're going to insert. You shouldn't need any resistance. Doing it on a dummy you kind of do, but on a normal person you wouldn't. So in you go in until you can see urine traveling down the tubing of your catheter, the drainage tubing, and then you want to go 2 to 3 more inches. Then you're going to want to hold on to that catheter so it doesn't slip back out, making sure you're in the bladder before you inflate the balloon. Anytime you inflate the balloon, they should not feel any discomfort. So once the balloon is in, the sterile procedure is over, and you can remove your stuff. You're putting the stat lock on, which is in your kit. All catheters should have the stat lock. A little trick of the trade was to that helpful assistance is to put the stat lock on. It needs to go with the arrow up. But if you put your stat lock on before you put it onto the leg, you need to prep the leg. There's 2 little swabbies in here. So prep your leg and let that dry, and that helps to build the barrier once you get this on. So then you can take off your sticky stuff. And you want to have a loop in the, you want to make sure where you put it so it's on the inside of the thigh. Usually about a hand's breadth from the groin works, but most importantly, you don't want to stick to your glove like that. You want that little loop in there so that it freely moves back and forth. That would normally, you won't have to do that, that should just come out, but that's the kind of nice little loop you want. You can move it, they can move their leg. And then this, the drainage bag, you want to go on the bed so that it doesn't touch the floor. We have a cart here, but we're just going to make sure that it's below the bladder. The drainage bag always needs to be below the bladder. And then lastly, we want to put the orange sticker on with the date and time of insertion and our initials onto the part of the urinary bag that doesn't have the markings and measurements. And there we go.